Three common medications might be impacting your thyroid in a way that you probably don't want it to be, and most people don't even know it. So before you blame your thyroid for fatigue or weight gain, what I would like to offer you in this short video is an encouragement to check your medicine cabinet. This is being recorded as of May 29th, 2025. And this week, I had the great pleasure and honor of speaking to two very large groups of doctors about thyroid health. And this weekend, I'm going to be teaching an entire 8-hour course on this. And so I was inspired to share this for the Women's Health series on Friday, this short video about that. And then I will do the longer first hour of that seminar to get a deeper dive into this to answer those questions. But in the interest of being short in this video, I just want to show some research that I came across in this. And what this is looking at is medications impacting thyroid function, meaning oftentimes, potentially, thyroid medication is being prescribed, and maybe all these things that I'm about to go over haven't been examined first. The conclusions of this study, and I'll put these links below, is that the accurate interpretation of abnormal thyroid function test results, meaning anybody who's gone and had a lab done on their thyroid, and a lot of people are using Function Health now and getting a complete lab, which is great, but they may be complicated by the concomitant presence of medications and non-thyroidal illnesses, meaning that just because those labs are off does not necessarily mean that it's the thyroid that we should be fixated on. It is important that clinicians recognize the effects of drugs on laboratory interpretation, drug-induced thyroid illnesses, and exogenous thyroid requirements to prevent medical treatments that may be dangerous and or that inappropriately increase the cost of caring for the patients. Now, that's very important to note. Just because something is showing that it's a little bit off doesn't mean that we should incur the cost in somebody having to take a medication, and it could be dangerous. And what do I mean by dangerous? Well, there's something everybody should know about when you're taking medications. It's called the Physician's Desk Reference. It's called a PDR. And this PDR, as you can see here, shows for levothyroxine a very long list of adverse reactions. Things like heart failure, cardiac arrest, arrhythmia, seizures. So when something has potential to have these serious, severe adverse reactions, I think we should take a little more time before we jump in and just go for a fixation on just the thyroid. There's a long list of moderate and mild. One thing that's interesting in this physician's desk reference is it also points out contraindications. There is a boxed warning on levothyroxine, and one of those contraindications is something called uncorrected adrenal insufficiency. Why do I point that one out? Because it's not necessarily being examined before this medication is being prescribed, from what I can understand. So I think there should at least be a question before having that medication put on, fixated on the thyroid. Is there adrenal insufficiency? Because we live in a society where we've got these tiny little adrenal glands. And I actually don't remember telling somebody this, but they taught it back to me. And so I'm so excited to remember this. And they said, I said to them that your adrenal glands are this big, but you're living your life like they're this big. And that's what a lot of people do. We just kind of go, and we don't take the time to recover. So there is a distinct possibility that you may be somewhere around uncorrected adrenal insufficiency, and you should at least take the time to rule that out. And let's just look at a couple of the other contraindications for that. Actually, hyperthyroidism, active cardiac arrhythmias, acute myocarditis. So these are things that we should know are part of a normal, not normal life, but a common part of an American life, that we should definitely be looking at these before we go straight into that. Now, I'm not telling anybody to take medication or not take medication. What I'm saying is that you should know all the risks before you are taking one, even though a well-meaning, well-intentioned practitioner may be offering this to you and saying, I think that this is helpful. You still need to take responsibility and dig deeper, because they may not have had the time to rule out all these things themselves. So we do need to take a little responsibility ourselves. Now, what are the medications that I mentioned earlier that could also be? These are pretty common ones, and I just want to show them to you really quickly. Beta blockers, people taking a beta blocker for blood pressure. Now, it's not all the time, but it's worth noting if you're taking that and you had your thyroid checked, that decreased thyroxine to triiodothyronine conversion, meaning the T4 to T3 conversion. Those are the thyroid hormones, and I'll go into those into the very long next video I make on this. Conversion is caused by some, but not all, beta blockers, and this appears to correlate with the membrane stabilizing activity. So what is that saying? Is that there's potential that that could be affecting thyroid labs. So just be aware that that could be something that could be impacting it. The next one that I want to point out to everybody is NSAIDs. So often people think that this is totally normal to be able to take these all the time. We're talking about like Advil, we're talking about Aleve, we're talking about aspirin. These are a category called a non-steroidal anti-inflammatory drugs. I have a whole video coming out this Sunday on that to get really deep into the understanding of headaches. But specifically here, it does say that if you're taking those, that could be impacting your thyroid. Clinicians should be aware of medications, for example, these non-steroidal anti-inflammatory drugs that can displace thyroid hormones from thyroid-binding globulin and transiently elevate free T4 and free T3 concentrations and depress thytropin levels. You don't need to know what all of those little words mean. You just need to know that it's definitely having an impact on your thyroid, and that should be taken into account when you're looking at taking thyroid medication. The next medication is one that I talk a lot about, that we need to be a lot more aware of the side effects of this one. And that is because it's the most widely used antidepressant in the world. And it's in a class called SSRI, Selective Serotonin Reuptake Inhibitors. I will dedicate many other lectures to and videos about that. But specifically in this one, I want to point this out, that it's been shown to have adverse effects on the endocrine system. Your thyroid sits right in the middle of your endocrine system. And whenever I want to talk to somebody about their thyroid health, I want to talk about their whole endocrine system, because it's like a symphony. You can't just tune one portion of the orchestra and expect that the rest of it's going to sound good. You have to tune the entire symphony. And that's what your endocrine system is a whole symphony. Now, it also emphasized a dysregulation in glucose metabolism. We have massive problems in the United States with people having glucose dysregulation. So we don't need something else that's building on that. Sexual dysfunction and fertility all impacted by these class of drugs. This alarming topic necessitates particular consideration, as the awareness of these effects could aid physicians in selecting the most appropriate treatment plan, and more notably, in monitoring the clinical progress of the patients during their SSRI treatment, with particular emphasis on the endocrine system. Now, again, I'm not telling anybody what to do, but I'm saying that you should be aware of this data, because there's a reason that this research was done. And if you are going to be having something that's coming into your body that is a medication, you should know all of what it's doing to your body so that you can know what to do next for yourself. And the final one I want to point out is something called lithium carbonate. Now, we should all know lithium carbonate is actually listed as an essential medication by the World Health Organization. So a lot more value in this is than what people realize. But what you should also know is that hypothyroidism and subclinical hypothyroidism, meaning something that may not be showing up in a lab or clinically, have been reported in 5 to 20% and as high as 50% of people taking lithium carbonate. Now, I emphasize carbonate because people get a little confused about lithium. They start thinking about lithium batteries, they think about other ways in lithium, and they think of this medication. But lithium is an actual mineral that is naturally occurring in a lot of foods, and especially in water. And it's different when we get it from foods and water. When it is in a carbonate form, it's one of the least bioavailable forms. And so when it's being given in a medication, it's given in very high amounts compared to what you would be getting from water. I've seen people having it up to 1,800 milligrams a day. Usually starts around 300 milligrams a day. So this is a different thing than getting it from water or getting it from food. So just keep that in mind. It's a much higher and potent dose when it comes to that. But it also said that a smooth, non-tender goiter is observed in up to 60% of those receiving lithium for 5 months to 2 years. Hypothyroidism may not be present. So what I'm saying there is that if you're on this for a long time, you should be looking at protecting your thyroid and your whole endocrine system as much as you possibly can. And just know that there may be more natural ways that you can actually get the value of lithium without it having to come from the carbonate form. Okay, so a lot of details in there, but this is mostly intended to empower you to understand that when it comes to your thyroid, there's a lot more that you should know going into the picture instead of just thinking I looked at one lab and that means that I should be taking a medication necessarily. Now, again, I'm not going against your physicians. I'm just bringing more knowledge to you to bring to the conversation with them so that together you can serve you in the best way. So the next video that I'm going to be releasing on the same day is the full first hour of the lecture series that I do on this so that you can get a deeper dive if you want to know more about this in particular. All right, I appreciate you watching these weekly series for women's health. There's a lot to learn. There's a lot to share. And I'm constantly open to learning more from you as well. So if there's something you feel like I'm missing or I didn't say exactly in a way that made sense to you, please leave a comment below. I want to make sure that this is totally understood. And as I always say, I know what I'm saying, but I don't know what people are hearing. Everybody's experience in life is going to change how you're hearing exactly what I'm saying. So again, tell me what you think you heard. If it didn't sound right, I will make sure that I can clarify, because if the most important thing is that you're getting information that's going to be helping you and be more empowered and being able to make sure that you are around for the long haul and you're making choices that are going to serve you 10, 20, 30, 40, 50 years down the line. Thanks again for watching, and I look forward to reading your comments.